Well, a warm welcome to today's talk, Thursday, the 8th of September. And of course, today we start by noting with great sadness the death of our Sovereign Lady, Queen Elizabeth II. Her Majesty died this afternoon, and we extend our condolences to all of her family. And in the tradition of my culture and my country and my religion and her religion, we now say, God save the King. Now, I'd planned to do today's talk on excess deaths, so I'm going to carry on doing that. The connection was not planned in any way, so I'm going to carry on what I prepared before the announcement of the Queen's sad death. Because these excess deaths that we're suffering from at the moment throughout the Western world, throughout our advanced civilizations, as we like to think, they're not caused by COVID. I'm going to be giving evidence for that. Now, some are caused by COVID as well, but we're seeing excess deaths beyond those which are caused by COVID. Now, let's start with this graphic here from Our World in Data. That excellent site with lots of information. Now, you can't see this too clearly, but this line here, round about here, is 20%. But if we look at this as a blown up version here, we do see the live situation in terms of excess mortality, and it really is quite high. So the United Kingdom, then Ireland, Netherlands, Australia, New Zealand, United States, Italy and Canada, all with more deaths than would be expected for the time of year, quite significantly more in quite a few cases. And what we're going to do, we're going to give evidence that this is not entirely attributable to COVID. In fact, the vast majority of is now not attributable to COVID. That's why I wanted to put this graphic up, because this is like live data from now. And we know that COVID deaths are down significantly. Now let's look at that. Office for National Statistics, first of all. Before we go there, just let's look at it's the same everywhere. So the United States, COVID cases are down 21%. Hospitalizations are down 13% and deaths are down 13% in the United States. So this is not just a UK phenomena. In England, as we see, the percentage testing positive, and of course this is based on proper surveys carried out by the Office for National Statistics, we know that the number of cases is going down. Now, the very latest data actually from the COVID symptom tracker app does show a slight increase in data. So this might be levelling off to increasing next time. But basically the trend is downwards, and certainly the trend in hospitalisation here we see is down, and the light blue line there, intensive care admissions also down. So the pandemic is becoming less severe. Now, this is the amount of people admitted to hospital. So we see about 40% of people who are admitted to hospital primarily because of COVID. And we see this other 60% here are admitted to hospital with COVID. It's an incidental finding. COVID is becoming less severe. We are delighted to say. But the key thing we want to look at here is the excess deaths. Now, the blue lines here, these are COVID deaths. These are all deaths here. And the dark black line there is what will be expected for the 5-year average. But of course, the 5-year average of deaths is higher because of the deaths that we've sadly suffered over the last 2 years from COVID. So that means that the excess death figures are actually more than we would expect, because the last 5-year average has been increased by the increased deaths from the previous 2 years, only leaving 3 years of the average before the pandemic. And again, we can't see that in detail. So here's the blow-up version. Last few months, so the blue deaths are the COVID deaths, the black deaths are what we'd expect. So that means that this bit here, this greenish bit here, above the black line and below the blue line, are excess deaths that we wouldn't expect for the time of year. And we see this has been high for some time. This blip here is bank holiday data, which wasn't fully collected. So we've got clear evidence here of these excess deaths. And the week ending the 26th of August 2022, there was 505 COVID deaths, down from 622 the week before, but the total deaths registered in the country were 12,333. 15.4% above the national average. This is quite profound. And the figure from Australia seems to be, I'll be giving evidence for this in a minute, 16.6% above the national average that we would expect for the time of year. So there's definitely something going on, or many things going on here, and we will be looking at some of the possibilities for these shortly. But in the UK, as we say, we've got 15.4% deaths above the 5-year average, and that's 1,646 excess deaths for the week. So 1,646 people more dying than we would expect. 1,646 in a week is a lot. It's actually, that figure is compared against an elevated 5-year average, as we say, because of the COVID pandemic. And as well as that, the COVID pandemic, as the SARS coronavirus 2 infection, has basically killed people that were more vulnerable. So we would expect the people that are left alive now to be more resilient. So we would actually expect the excess deaths to be less at the moment. And we're seeing the exact opposite. So this figure is actually way worse than we would expect. Bearing in mind COVID deaths are only 4.1% of all deaths at the present time. Australia, as we say, this is the deaths from the Australian GP, general practitioner, news sheets, 16.6% above the national average. Now, some Australian figures do say it's slightly low, but they're all well over 12%. So it's definitely increased deaths in Australia and around the world, as we've noted. Now, this is the information on people that died with COVID, what comorbidities they suffer. Now, I'm aware you can't see this, so the first one is signs and symptoms of ill-defined conditions. Now, that's not acceptable putting that. The data should be broken down much more than that. Then dementia and Alzheimer's, chronic lower respiratory diseases, diseases of the urinary system, diabetes, heart disease, ischemic heart disease, high blood pressure, cardiac arrhythmias and cerebrovascular disease. But these are the conditions which predispose towards deaths in COVID. We're dealing with a completely different situation here. These are non-COVID excess deaths, and we really have to get to the bottom of this international scandal. Very high death rates around the world. We have to know. We have to know what's going on. We need the information to be able to judge what's going on. At the moment, we're not getting the full information we need, and it's not acceptable. We have to have more information than this so we can work out what is going on. Academics around the world are chomping at the bit waiting to do this, but we don't have the information. Now, this is the Office for Health Improvements and Disparities. This is the UK. Now, these are the excess mortality in England in all persons. So we can see that it's higher here. We have this excess mortality. But again, I've blown that up so we can see it. This is the last 19 weeks in England. And we see for the last 19 weeks, okay, it wasn't much higher just here. But for the last 19 weeks, we see an increase in the excess deaths above what we would expect in England, in this English data. And England here is fairly typical of all these other countries, as we've illustrated. I'm just using England because we've got the best quality data for England here. The excess deaths here are there, and they are not attributable to COVID, or not all attributable to COVID, as we've seen. The majority are not attributable to COVID. And the excess deaths is in all age groups. Now, of course, in the pandemic, we saw excess deaths in people with comorbidities, in older people, tragic, of course, but now we're seeing excess deaths in all age groups where we have the data breakdown. Now, the first data breakdown we've got is in the 0 to 24-year-olds, and we see the excess here. And again, I'm going to blow this bit up so you can see it more clearly. Here we see the excess deaths in the 0 to 24. These are actually COVID deaths here. There's been a very small number of them. Okay, the scale here is small. That's why I put that there. That scale there is 100. But this is still a significant increase. So this is what we would expect. And we see here that all these deaths, this light grey line is deaths more than we would expect in the 0 to 24. We are talking about our youngest, fittest people here dying at a higher rate. This is not talking about particular comorbidities necessarily. It's just identifying that more of these younger people are dying. Something is going on, and there's similar data from around the world. 25 to 49-year-olds also, and again I'm going to show you the blow up of the last part of the graph there to illustrate this. I mean, these high deaths here are COVID. We expect that, of course, even in the 25 to 49-year-olds, sadly. But again, when we look at it, the dotted line is what we would expect, and we're getting higher non-COVID. So all these light grey deaths here are non-COVID related deaths, and they're higher than we would expect. 50 to 64-year-olds, again, we see the COVID death that we would expect, but when we blow up this last part here, we see this fairly profound picture of increased deaths above the dotted line, not attributable to COVID. And in fact, we can see that in most times the non-COVID deaths here are higher than the COVID deaths in terms of the excess deaths. Now, we do have some causes here. So excess deaths from specific causes. This is the ischemic heart disease one, and we see this has been higher for some time now, throughout the pandemic, years in fact. But if we look at the last few months again, we see ischemic heart disease deaths. Here they were lower, here they were lower, but most of them are higher than we would expect. Ischemic heart disease is where there's not enough blood supply getting through to the myocardium, the contractile muscle of the heart, causing myocardial ischemia and general lack of blood supply to the heart. And again, we see that deaths from this are higher than normal. And particularly heart failure. Heart failure deaths are quite a lot higher than normal, as we see from this graphic here. Now, you get the scale from this line here, so that's 500 there. But when we see the blow up, again, we see they've been higher all the time than we would expect. Now, this is heart failure. Now, what heart failure is when the heart muscle is no longer able, or when the heart as a whole, we should say, is no longer able to contract sufficiently to generate enough cardiac output to pump enough body out into the systemic circulation to maintain the metabolic demands of the body. That heart failure is exactly what it says. The heart is failing as a pump. That can be caused by disease of the valves, but it's also very commonly caused by disease of the heart muscle itself. It can be caused by cardiomyopathy, for example. And that's what we're seeing in excess deaths in. So this is what we're seeing here, and that's the blow up of that. We're seeing that. Cancer. Now, the situation with cancer is not quite as bad. Again, I'll show you the blow up here. We are seeing excess deaths some of the time in cancer, and also reduced deaths. The average is higher. Now, I think the situation with cancer is we will see more excess deaths with cancer in the weeks and months to come. But at the moment, while we're seeing some, I'm afraid we might be seeing more later in the next year or two. And again, we've got 5,000 and 1,000 there on that scale. That's the 500, that's the 1,000. So some excess death with cancer could get worse. Acute respiratory conditions, well, we are seeing more deaths from acute respiratory conditions. Chronic respiratory conditions, we are seeing more. Diabetes, we are seeing more. This is the blow up of the graph for diabetes. We are seeing higher deaths from diabetes than we would expect. So there's excess deaths across the age range, and there's excess deaths across the different sorts of pathology range as well. And we've only highlighted a few of them here, otherwise this video will go on for a long time. We could have mentioned urinary, liver and cirrhosis being the accumulation of scar fibrous tissue in the liver. Parkinson's disease. Parkinson's disease is normally caused by a degeneration in part of the brain called the substantia nigra, and results in rigidity and tremors and general slowing down and loss of facial expressions. We're seeing more deaths as a result of this incapacitating condition. So we could have mentioned those in detail. Now, I want to talk about proximal versus distal causes of death. And we haven't got much to go on this video, so stick with us because there's an important difference here. Now, the proximal cause of death is what causes death immediately. So we looked at the ischemic heart disease, we've looked at the heart failure, we've looked at the respiratory disease, we've looked at the diabetes. That's what can cause the death immediately. Now, you could say that is the proximal cause of death, but the distal cause of death is more distant. What has led to the ischemic heart disease? What has led to the diabetes? What has led to the cancers? What has led to the increase in respiratory diseases is really, to my mind, the more important question. So I want to look at a couple of those now. Now, healthcare issues, of course, waiting lists for treatments. People can die waiting for treatment, of course. Fear of attending hospitals and doctors during lockdowns. I'm afraid still a lot of doctors are still practicing triage. Triage means to adjudicate how serious a condition is by telephone. You have to look at your patient's face to see how sick they are. When you've been practicing for a while, you can tell by looking at someone. Of course, you do tests and histories as well, but if someone doesn't look right, you think, oh, they don't look right. You can just see it straight away. How can you do that on a telephone? Even if it's a video call, it's just not the same. We have to move back now. We have to live with COVID and move back to face-to-face consultations, in my view, because so many people are dying, because more people are dying from non-COVID deaths than from COVID deaths. And that trend appears to be continuing, and it's really quite alarming what is happening. Review of long-term treatments is another one. So some people are on medication for long-term, statins, blood pressure control, diabetes control, things for chronic respiratory disease, things for chronic inflammatory diseases. And these medicines, okay, you can start someone on them 1 year, but you need to review them. They should be reviewed really every 6 months or every year, or even more often if you can. And if they're not reviewed, people could end up on medicines that were right for them 2 years ago, but not right for them now, not treating their current pathology. And has there been a lack of long-term review of reviews of long-term treatment? I think there probably has. Delayed diagnosis, of course, severe conditions not being diagnosed. Long COVID as well, there's post-COVID syndromes, COVID sequelae. We know this is the case. People are getting diseases as a consequence of having COVID in the past or having ongoing long-term COVID, particularly it appears from early anecdotal data largely related to coagulopathies, where there are various blood clots in the circulatory system leading to what we call thromboembolic disease, but other causes as well, heart disease, heart damage from COVID, lung damage from COVID, maybe renal and hepatic damage from COVID as well. So more to learn about these post-COVID syndromes. Lockdown sequelae of the pretty disastrous lockdowns that we had, the physical and the psychological effects of that. Now, this is a YouTube video, of course, so just to clarify my position, these are direct quotes from the YouTube site. Don't post content on YouTube if it includes harmful misinformation about currently approved administered vaccines on any of the following. So let me make it clear. I am not going to be doing this because I must follow the guidelines. YouTube guideline on vaccine safety. Content alleging that the vaccines cause chronic side effects outside of rare side effects that are recognised by health authorities. I can't say that, therefore I'm not saying that. I'm abiding by the YouTube guidelines. And also from the YouTube guidelines, claims about COVID-19 vaccines that contradict expert consensus from local health authorities and the World Health Organization. So we cannot say, we cannot make claims that an approved COVID-19 vaccine will cause death, infertility, miscarriage, autism, or contraction of other infectious diseases. So let me make it clear, I am not making claims of that sort. But we are noting that these are possible causes of the excess mortality that we are seeing. So So there we go. We've got these excess mortalities. We must have more data. And yeah, we need more data, and we need to discuss this data. We need to be able to discuss this data. Academics around the world need to be able to analyse this data. And we need to work out what is causing 1,600 additional people, apart from the small percentage that are dying of COVID, what is causing these people to die around the world in greater numbers. Because if we carry on the way we're going, certainly for 2022, way more people are going to die of excess mortality in 2022 than of COVID-related mortality. And we need this information and the freedom to analyse this information as a matter of national and international emergency, in my view. So we are reminded of the importance of every human life. These aren't numbers, these are individuals. And thank you for watching.